السلام عليكم. نبلش محاضرات the gram negative enterics. راح يكون تقريبا موقع 4 محاضرات ما يعادل 4 محاضرات، فخلينا نبلش إن شاء الله. بالطريقة الموجودة بكتابكم and the way that I prefer اللي هي نقسم هذول the large group of gram negative rods that are present in the gut into 3 main categories according to where they cause disease. هلا احنا كلهم مع بعض we know that they are present in the we all know that they all have the same place and they all live in the same area, they all live in the gut. That's not something that we can divide them on, but we can divide them on where they cause their disease. Do they cause their disease mainly in the enteric tract, ولا outside the enteric tract, ولا both? So pathogens that cause disease both within and outside the enteric tract اللي هم اللي هم E. coli, Escherichia and Salmonella. راح تشوفوا إنه the pathogens that are primarily only within the enteric tract كله بس بيعمل enteric و diarrheal disease راح يكون شيجيلا، فيبريو، كوليرا، كامبيلوباكتر أو هيليكوباكتر. هيليكوباكتر بتعرفوا ما تعملش diarrheal disease وتعمل هي peptic ulcer. So pathogens outside the enteric tract راح يضلوا هي كليبسيلا، دول ما بيعملوا عادة in the most case they don't cause a disease inside the enteric tract. يا بيعملوا بالurinary tract، يا بيعملوا بالlung، يا بيعملوا بالblood. So we have Klebsiella, we have Proteus, Prudential Morganella group, Klebsiella, Enterobacter serratia group, we have Pseudomonas, and then we have the anaerobes, bacteroids, and then Prevotella. هذول هم راح نغطيهم هذول المحاضرة. So E. coli, تعرف E. coli is the most heavily studied bacteria maybe. It's the default أو مثلا the classic gut bacteria. And this is a picture of E. coli. You can see this is quite a, it's not a cocobacillus, it's a full bacillus, and it's showing here a gram negative reaction. Hi, you can see these are curved rods. These are curved rods وعندهم هذول this sort of flagella. So these are moving rods. This is Vibrio cholera. So you can see these gram-negative rods. Then shows the flagellum at one end of a curved gram-negative rod. This is more of the same gram-negative curved rods, but you can see they don't have you don't have this. You don't see the prominent flagella in this case. إذا حدا فيكم بيعرف مش عمره شاف اللي بسموها نودل سوب. تكون مثلا شوربة وفياتها these small circular noodles مقطعين. So it looks like, to me, that's how I usually describe it to others. It looks like gram-negative noodle soup. You can see these curved rods. This is Helicobacter. This is what causes, if you are a service that cultures Helicobacter, you will commonly see this as well. So these are some of the examples that we have. So let's talk about the frequency of diseases caused by these gram-negative rods that are related to only the enteric tract. So enteric tract, the site of infection, enteric tract, you see the most frequent pathogens, the dominant pathogens هم Salmonella, Shigella, and then Campylobacter. هاي الأرقام بتتفاوت ما بين وقت لوقت، بتتفاوت ما بين دولة لدولة، بتتفاوت ما بين منطقة لمنطقة حتى within the same country, but we always have Salmonella, Shigella, and Campylobacter as the dominant causes of enteric tract infection. Okay? إيش يعني enteric tract infection؟ يعني diarrheal disease, gastroenteritis. That's what we're talking about. Less frequent pathogens that are less frequently encountered that cause enteric tract infections. E. coli, Vibrio كتير قليلة إلا مثلا مناطق أفريقيا, and then Yersinia as well. UTI, the dominant pathogen, overwhelmingly, especially in the community and not hospital, he E. coli. E. coli is the most common cause. ذكر حكينا أكثر من مرة. It's the most common cause of urinary tract infection. So we have then less frequent pathogens راح يكونوا enterobacter, klebsiella, and then proteus, pseudomonas. هذول راح تشوفوهم هذول بيختلفوا حسب يعني حسب المنطقة وحسب المستشفى وحسب the المستشفى or community. So you can see Klebsiella is very common in hospitals where there is a high degree of multi-drug resistant pathogens endemic to that hospital. Enterobacter كمان كتير موجودة. Pseudomonas will also be with manipulation. So a lot of these as well can be seen. But the dominant one حتى بالhospital will still be E. coli. So now let's look at the table, and you can see that we like to use table as a guiding mind map. We use that table, and then we explain and put more meat on the skeleton. So let's make a skeleton out of the information in this table. So we always talk about how bacteria cause disease. They either cause disease by invasiveness, pyogenic disease, or toxin-mediated disease, or immune-mediated disease. هلا in the enteric tract there is no significant immune-mediated disease. هلا راح إذا بتفتح كتب وبتفتح articles and review articles, you will see there is mounting evidence of immune-mediated disease out of the gut. حتى لدرجة إنه بيحكي مثلا even lots of known diseases اللي هي نعرف عنها مثلا inflammatory diseases, even heart disease can be linked, even مثلا psychiatric illnesses, even neural illnesses, neural system, كلهم هذول they are linked to the inflammatory state of the gut. It's not really this is not present in this table, but we can know that immune mediated بجوز ما تكون as clear cut as rheumatic fever مثلا, but we know there is immune mediated disease. لكن for the sake of the exam, the sake of إنه إحنا بهالمنطقة الحالية, so we don't want to go ahead of ourselves. Probably in the future you will see immune mediated disease added to this table. فخلينا up to this point we only have the two mechanisms of enterotoxin mediated and invasive inflammatory mediated. And then we have those that with the uncertain mechanism. عادة هم the least common ones that cause enteric tract infections, خاصة Vibrio and Yersinia. فخلينا نشوف شو في عنا إشي غريب. Okay, so let's see all the ones that cause enterotoxin mediated disease do not have fever. There's no fever. Fever in the gut equals pyogenic, equals invasiveness, equals blood, okay, equals white blood cells. So we will see that these are all positive, leukocytes in stool, blood in stool. حتى مش حاطة هون بالتابل. Fever هو مش حاطها لأنه يعني I can see why he doesn't want to include it, but let's for our sake let's include it. حتى blood in the stool, you can see you can always add it here. So invasive inflammatory, you have always fever, دائما في fever. There is invasiveness معناته دخلت على blood. These are gram negatives, so they will shed their endotoxin into the blood. That will cause fever. As they are going through the blood, leukocytes with Th17 response will mount. كل الوايت blood cells بدهم يدخلوا, and then يدخلوا على الgut, and you will have leukocytes in the stool, and then you will have this invasiveness or destruction of the vessels will cause some blood to come out into the stool. So now that's our main point. The ones that cause enterotoxin mediated illness اللي هي Vibrio, cholera, E. coli, do not have fever. They do not present with fever. Obviously ما في fever, ما في invasiveness, there's no blood, there's no leukocyte in stool. تمام? So that's the first one. ثانيا إنه we can see there is a member that causes enterotoxin mediated disease and invasive disease اللي هو مين؟ E. coli. So E. coli has more than one. شو ليش موجود الممبر أكثر من مرة? Because each time the member will have different virulence factors. So the regular, خلينا نحكي اللي هي الطبيعية, regular E. coli is the one that can cause the enterotoxin mediated disease, and that's the regular one. هاي الطبيعية, هاي نحكي مثلا this is the Jane Doe, this is the Steve Smith. هذا إيش البني آدم العادي. هلا طورته صار يلعب برياضة وصار عنده مسدسات وصار عنده أبصر شو. It becomes more. So these strains become enteropathic. These are invasive strains. They can cause invasiveness. These will cause obviously fever and leukocytes too. And there are ones that have Shiga-like toxin. رح نحكي عنه. They even cause hemolytic uremic syndrome and cause much more damaging diseases. So this only applies for E. coli. The others, Salmonella, Shigella, Campylobacter, the ones that are dominant in the enteric tract and dominant, they are the ones that cause invasive illness. تمام? So now these are the two main things that we have. رقم 3, we are looking at infective dose. شو يعني infective dose? Is how many bacteria do you have to ingest to get disease. فكل ما كان قليل, here about 100. So Shigella, only 100 organisms can cause disease. So Shigella is more easily transmitted than any other. الثانية راح تكون Campylobacter. So أنت ما بدك تحفظ الرقم, بس 100 is really an easy number to know. So 100, then about 10,000, then about more and more. So Shigella بدك 100, then Campylobacter, then Salmonella. These are the common ones. بعدين طلع Vibrio cholera. You need a large number of infective dose to have. So we will talk about this when we get to Vibrio. So let's put these on a mounting scale from smaller to larger, as what is the infective dose for these. And then from your lab lectures, let's look. So we have the ones that are enterotoxin mediated. We have, E. coli. بعت لكم أنا صورة that has a picture of all the gram negatives. Just give me a second so I can add it. So we can see that the typical way that we can see this. So this is I just added to the slide. This is for your gram negative bacteria. So if you do a simple gram stain, if you see diplococci, this will be what? Nothing other than Neisseria. And we said that in Neisseria you can see if do they utilize sugar. The one in the brain will utilize sugar. So this is Neisseria gone. This is meningitis right here. Neisseria meningitis, the one in the brain, and then the one that is not in the brain, gonorrhea or Moraxella, will not utilize maltose. Is it Coccobacilli? These are the ones that we covered in the in the gram negative respiratory rods. اللي هم كانوا Bordetella, pertussis, H. influenza, right? So this is what we look at. It's just by the shape of these, and then we have let's look at the comma-shaped ones. They are usually oxidase positive, and then we can differentiate those according to 3 ways. So if it's a comma-shaped, it's not a rod. So remember we talked about cluster shape and shape. So this is just by the shape. So comma-shaped, gram-negative, they are oxidase positive. If it only grows in 42, this is Campylobacter jejuni. If it is a urease producer, نقدر مثلا نعمل breath test or whatever, this is H. pylori. If it only grows in alkaline media, this is Vibrio cholera. We are left only with bacilli. So bacilli, the first thing that you do تذكروا عن ماكونكي agar or something similar. ومثلا اللي أحكيكم عنه the triple sugar iron. So the first sugar that we look at is lactose. Does it ferment lactose? Yes. So you either have a fast lactose fermenter راح تكون هي E. coli, Klebsiella, Enterobacter. Citrobacter, Serratia are slow fermenters. No, then you either have this is probably Pseudomonas. وشو راح تعمل لها هنا? Oxidase. So oxidase is probably Pseudomonas oxidase positive, and then H2S producer if it's not oxidase positive. هي oxidase. So oxidase positive, yes. Pseudomonas oxidase negative راح تعمل له H2S production. بتعرف ال H2S production راح يعطيك this black color. This is Salmonella. No, it is Shigella. That is very easily done. So if we look at this, so the ones that ferment glucose are E. coli, and then we have more E. coli here, and that's it. And then the rest are not lactose fermenters. You can say that the majority of lactose non-fermenters are the ones that can cause disease mainly in the enteric tract. They do not have the capacity to go out the enteric tract, whereas E. coli comes out of the enteric tract. إذا نرجع شيجيلا سالمونيلا كامبيلوباكتر فيبريو نرجع على تبعتنا. So they are primarily Shigella, Vibrio, Campylobacter, they are primarily in the enteric tract. So usually the non-lactose fermenters do not leave the enteric tract. This is just a small way. So حكينا هلا Campylobacter comma shaped grows at 42. Vibrio مثلا Vibrio comma shaped bacteria, and then we have Helicobacter اللي هي by looking at urease activity. Helicobacter مش موجودة هون. Okay. So now we covered this table. Now we can move a bit forward. This is our gram-negative bacteria. For the sake of completeness, I put the gram-positive bacteria as well. نتذكر and we know, are we looking at the shape, cocci, bacilli, or branching filaments? Branching filaments ما حكيت لكم عنها هدول. If we have time, I'll add them to your lectures. But nocardia, you used to be thought of these nocardia and actinomyces. Okay, so these we'll see if we can talk about them. Actinomyces usually not acid fast, usually part of the normal oral flora. And nocardia, they used to be thought of as fungi because they branch much like fungi, but now we know they are actually bacteria. So and then we have the bacilli. The main way that we can talk about bacilli is whether they are anaerobes or aerobes. So anaerobes Clostridia, aerobes will be all the others. So now we have then left we're with cocci, the main shape for gram positives. راح نشوف مثلا شو نعمل تذكروا catalase or coagulase. So catalase positive would be staph, coagulase positive would be staph aureus, coagulase negative would be the epidermidis and saprophyticus. Which will we do? Nevobiasin حكينا إنه we can see that if nevobiasin sensitive would be for saprophyticus and epidermidis. As I recall, the one that is in the dirty area will probably be resistant. So this is saprophyticus is the resistant one. And then we went to catalase negative, will be with the streptococcus. ذكر نعمل hemolysis alpha beta gamma. Alpha will be these are the green ones. Is it viridans or is it pneumonia? حكينا the dominant one in the optician sensitivity. Who is the sensitive? Pneumonia, the encapsulated one, and the one is in the mouth where all the dirt is will be resistant. So this is optician resistant. But then we won't go for gamma hemolysis. These are the ones that live in the gut. And we remember حكينا نعمل مثلا bile esculin أو نعمل 6.5% NaCl. Enterococcus اللي هي the hardy one, the one that has all the resistance will be yes, and the others will be all no. And then we are left with the beta hemolytics. Is it alpha group A or group B? اللي هي had group B. So basic trace insensitive. Who Streptococcus pyogenes group A is it sensitive? Yes. Agalactia وين هاي موجودة? So remember this is in the women. So this is in the data area. يعني هيك فكروا فيها. Near the genitals, whatever. This will probably be more resistant. So this is resistant to basic tracing. So that's all. This is basically medical microbiology. So you can work in the lab right now. This is yet another one, a bit more complicated. Just what we mentioned about gram positives. Just adds cocci together. So there's nothing else to add here. Okay. So gram negative rods causing UTI or sepsis. So now we are talking about outside the enteric tract. So now we are outside the enteric tract. E. coli is our main one, especially in the urinary tract. So obviously this is a lactose fermenter. We here see, as we mentioned, we see more lactose fermenters in this area. Enterobacter causes nosocomial infections. E. coli colonies or EMB agar Klebsiella pneumoniae, large mucoid capsule can cause viscous colonies and then can cause pneumonia. Serratia, red pigment, Proteus, motility, swarming motility, Pseudomonas, blue green pigment. كل واحد إلها هون أحمر، أخضر, motility, large mucoid capsule, sheen on EMB agar. So all of them have this this characteristic color or shape. So this is another one that I used to mention before. So bacilli are the obligate anaerobes. هون بنحكي عنهم هدول كلهم. And then you have the aerobic facultative anaerobes bacilli. And then we go for this one talks about the 3 sugars, and this is a segue into talking about the triple sugar iron test. So we look at glucose, we look at lactose, and then we look at I think lactose, glucose, and I think the third sugar is not mentioned here. Okay, so facultative anaerobes, glucose non-fermenting, and then you go for non-lactose fermenters. Oxidase positive, you'll have Pseudomonas. This is in our Enterobacteriaceae. This is for Enterobacteriaceae. اللي هم أغلبهم enteric bacteria in the gut. And then you look for glucose fermentation, either oxidase positive or negative. Enterobacteriaceae هندخل عليها هنا. So go for the lactose fermenters. هم هيهم E. coli, Klebsiella, Serratia, Enterobacter اللي حكيناهم. And then the non-lactose fermenters هي Shigella, Salmonella, Providentia, and all the others. So this is just a segue to saying non-lactose fermenters you'll have here Vibrio as well. احنا ندخل عليهم هذه النقطة وهذه النقطة وهذه النقطة هدول الأشياء اللي بيهمونا for the talking about the new. So this is the EMB agar. This is the green sheen that is seen only for E. coli on the EMB agar. This is McConkey ورجيناكم قبل هون where lactose fermentation changes the color indicator into pink, and then non-lactose fermenters will remain colorless. So on SS agar is the one that you can see the H2S stain. So E. coli will just change the agar. It's more selective and differentiated than McConkey. You just see the lactose fermentation. Shigella will not change the color, whereas Salmonella will change the color, H2S production, and then will give you this black metallic color on. Now we go to, this is the peptone media with phenol indicator. So this is for glucose fermentation. So uninoculated, this is what it looks like. If you put E. coli, you will change the color indicator as you are using the glucose, and then there is gas production here. So this is a glucose fermenter with gas production. This will be E. coli. And then we have مثلا Salmonella, a part of Salmonella. This does not produce gas but can utilize the glucose. And Pseudomonas does neither, just like an uninoculated tube. So this is the non-fermenter. So Enterobacteriaceae and related organisms. The Enterobacteriaceae is a large family of gram-negative rods found primarily in the colon, many as part of the normal flora. These organisms are the major facultative anaerobes in the large intestine, but are present in relatively small numbers compared with anaerobes. So anaerobes are more dominant, such as bacteroids in the gut. You will see that as normal flora, they help you digest a lot of things, even in the cycle of مثلا bilirubin and biliverdin. You need gut bacteria to digest a lot of your food and a lot of your recycling of material in your body. So these enterobacteria are part of the normal flora of the gut. So now let's talk about the diseases caused by members of Enterobacteriaceae. Okay, so now let's talk about the diseases caused by the members of this group of Enterobacteriaceae. When do they cause disease? So as part of your normal flora, that means they are opportunistic infections or infectors. So they can only cause infection when there's something wrong. You have messed up the balance, they have gained access to somewhere that they shouldn't be. So that is definitely true for E. coli. If they gain access to the urinary tract, they will cause urinary tract infection. If you mess up your flora, you go to another country and you eat different E. coli or different bacteria that mess up your gut, you will have traveler's diarrhea. If they gain access through the birth canal into the baby, they can cause neonatal meningitis. Shigella is if they can break through. حكينا هذولا are mainly in the gut. So Shigella, if they break through the gut, they can cause dysentery. Dysentery is basically diarrhea with blood. That's what it means. Salmonella هاي تعمل typhoid fever. So it's an enterocolitis, it's a fever, so it's a feverish disease with weakness, constipation, and then green colored diarrhea and a lot of complications and rash. So that happens with salmonella. So and then you have Klebsiella enterobacter serratia group, all have pneumonia, urinary tract infections as the area where they cause. And you can see these are all the non-lactose fermenters, the lactose fermenters are all causative of UTI. E. coli, Klebsiella enterobacter serratia, all of them cause urinary tract infection and outside. And now we are only left with Proteus. It's not a lactose fermenter, but has another mechanism, which is the high motility that can allow it to travel from the gut to the ureter. The urethra. So Yersinia is the one that causes the plague. We'll talk about it in a minute. So features common to all the members of this family, all of them are fermenters of glucose. So all of them will, in the triple sugar iron, they will ferment at least one sugar. So if you go back to this is the family, and this is where glucose fermentation are happening. So the non-glucose fermenters will be Pseudomonas, will not ferment glucose. And then, so this is important to notice. And then this is where we saw this test here. Okay, so they all ferment glucose, they are all facultative anaerobes, and they are all present in the colon. They all have, none of them have cytochrome oxidase, they are all oxidase positive, so the PVNCH none of them are in the Enterobacteriaceae group. Helicobacter Enterobacteriaceae group, it's not, as we saw from the previous slide. So they all reduce nitrates to nitrites as part of their energy generating process. We can use this to detect E. coli in the urinary tract. The one with heavy nitrites إذا في معناته في عندك E. coli as the dominant cause of UTI. And these characteristics are also mainly to distinguish them from other important gram-negative rods, especially Pseudomonas. So Pseudomonas is a major nosocomial cause of UTI. It's not a glucose fermenter زي ما شفنا هلا. It's by oxidation, not by fermentation. ذكروا this is an obligate aerobe. It is oxidase positive, again, an obligate aerobe, and does not reduce nitrates. Again, it does not reduce to nitrogen. So pathogenesis, all as gram negatives, they all have endotoxin in their cell wall. So if they gain access to the blood and they get destroyed, they will cause sepsis. In addition, several exotoxins are produced by this member, especially E. coli and Vibrio. E. coli ilha enterotoxin, and Vibrio has another exotoxin. And both of them are called enterotoxins because they exert their action on the enterocytes. These exotoxins, both of them activates اللي هو adenate cyclase. This is the main mechanism. حكيناها, this is زي مثلا حكينا حكينا مثلا بالpertussis, where you have the like diarrhea. تذكروا حكينا like diarrhea in the respiratory tract. So this is the same mechanism. In this way here, you have a lot of adenate cyclase will activate the cells, which in case they will transmit a lot of their intracellular water into the lumen, and this will cause watery diarrhea. So significant antigens used for diagnosis. What do we use to diagnose these organisms? We have O, H, K, these three antigens. O antigen is the cell wall antigen. عادة serology in O, we use the O group for serology. So serologic diagnosis عادة uses the, where are we? Okay, so O antigen in the cell wall for serology. There are a number of different O antigens used for many. So there are 1500 types of Salmonella, 150 types of E. coli. So it is not really usually used for all of them. That's why we need other antigens to look at. The H antigen is for the flagella. So obviously this will only be for motile organisms. So E. coli, Salmonella. So Klebsiella and Shigella will not have this antigen as they are non-motile. K, capsule, K means capsule. So this is the capsule antigen. It's heavily encapsulated organism. Mean Klebsiella. So this is killing reaction. Also E. coli, Salmonella. Also you can use anti-capsular antigens as well. Lab diagnosis. So specimens suspected to be Enterobacteriaceae are first inoculated on blood agar, then McConkey, then maybe EMB agar, and then you do other differential ways to the main thing is that you want to put bile salts to inhibit most of the gram positives, and then you want to differentiate them on the lactose fermentation. هذا حكينا احنا كان عن اللي هو كان ماكونكي. On these media, the non-lactose fermenters اللي هم راح يكونوا salmonella عادة shigella, they form colorless colonies, whereas the other lactose fermenters هون احنا ما بنقدر على البليت احنا ما بنقدر نفرق هل هو quick or slow الا اذا بنراقبه. So they will form the lactose fermenters will form colored colonies. And then on EMB agar, all colonies will have only the E. coli will grow as green sheen characteristic colonies. And then selective effect of the media is suppressing unwanted gram-positive organisms حكيناها by bile salts and other dyes مثلا. Okay, so so lactose fermentation, we know that the ones that are slow, Serratia, quick, E. coli, Klebsiella, Enterobacter, do not occur Shigella, Salmonella, Proteus, Pseudomonas. This is very important. So this is the segue into the triple sugar iron test. So second screening test consists of the triple sugars with iron and then urea agar, and then they are performed to reach definitive diagnosis. I think this was covered well in the lab. At this point, we would know the genus. Further biochemical tests are needed to identify species. The triple sugars مين راح يكونوا glucose, lactose, and then sucrose, plus iron as ferrous sulfate, and then the medium in the tube زي ما بتعرفوا has a solid poorly oxygenated area on the bottom. هذا هو راح يكون البط, and then an angled well oxygenated area on the top called the slant, and then the organisms will be inoculated into the butt and then across the surface of the slant. And then we can see من هالtriple sugar iron test we can see three main ways, three main things that we can see. Now, as they utilize sugar, and mainly if they can utilize كلهم عندهم glucose وعندهم lactose. So if they are lactose fermenters and glucose fermenters, they will cause the slant and the butt to be acidic. And that is true for E. coli, Enterobacter, and Klebsiella. Or those are the lactose fermenters, right? هذول lactose fermenters تبعينا. So in the oxygenated area we have acid. In the non-oxygenated area we also have acid, and that is true for the lactose fermenters. Now the lactose non-fermenters, Shigella, Salmonella, and then we have Serratia is also, this is a lactose fermenter, but it is okay. So this is a slow fermenter. So this will you will see that Shigella, Salmonella, they will only utilize glucose. So only in the butt, in the less oxygenated environment, you will have acid, whereas in the slant, in the oxygenated environment, you will have no fermentation of lactose. So you will have alkaline slant. Now Pseudomonas حكينا لا glucose ولا lactose fermenter, so it does not ferment anything. It will leave the media as it is alkaline. So out of the glucose fermenters حكينا you will have E. coli mainly and Klebsiella as gas producers. Salmonella produces also gas producers. So the way that we differentiate this from this, Shigella from Salmonella, is the H2S production. So H2S production is only present in Salmonella and Proteus. So تحطهم هذول كلهم in one test, and then you can see you can get multiple inputs from the test, and then you can make the diagnosis fairly on your diagnosis fairly easily. So هاي الأشياء اللي حكيناها is just written for you. If lactose or sucrose is fermented, a large amount of acid is produced, it will turn the indicator yellow both in the slant and in the butt. If only lactose is not fermented, but a small amount of glucose is fermented, this will only make the butt yellow زي ما حكينا هنا, only make the butt yellow in Shigella and Salmonella Serratia. Whereas if everything is utilized, you will have this acid in هذا حكيناها. If neither is fermented, you will have all red هذا الموجود بالسودوموناس. And then you can do oxidase مثلا to make sure. And then H2S produced, you will have the black color اللي هو موجود بالسالمونيلا والبروتياس. So now let's look. This is control. All of it red. Which one will have all red? This will probably be Pseudomonas. So this is red slant, red butt, no H2S, no gas. This is probably Pseudomonas. Now these have black, right? So you have these two black. So these are H2S producers. One of them is fermenting the lactose. One of them is not, right? So which do you think which is which? So this is actually, I don't think I mentioned for this, is Citrobacter. This is also a lactose fermenter. This will probably be مثلا Salmonella. So now we're left with these. We have two forms. One that is completely yellow, butt and slant, with gas and no H2S. So this is probably more likely E. coli. And then you have one that only produces acid in the butt. So this is probably only a glucose fermenter. This is probably some of the non-lactose fermenting, non-H2S producers. Probably, probably we're looking at Shigella مثلا. So here, the interpretation AA acid مثلا اللي هي كانت هون حكينا عنها E. coli. That's probably E. coli, Klebsiella enterobacter مثلا. The one that was KA حكينا عنها هاي Shigella. So yes, probably Shigella. Maybe Serratia as well حكينا because this is a slow fermenter. حكينا عن the one that was with an acidic butt but has gas and H2S production. So and then it was this one, and this is what we mentioned is probably this is probably Salmonella. حكينا Pseudomonas كانت هاي اللي ولا إشي. So we went through this, we went through this, we went through this, and this is actually طلعت هاي هي. This was all fully acidic with no gas and H2S production. This is Citrobacter. So now you can, I think this is fairly easy. You can easily help in a lab if you are needed. Urea agar, urease test. The important component of this medium are urea and the pH indicator. So the important one will be H. pylori, very, very important. Urease positive one. And then Proteus species and Klebsiella as well. Motility بتهمنا بالأشياء الموتile. حكينا Klebsiella is non-motile, Enterobacter motile مثلا. And then motility test you can inoculate the medium. This is a solid medium. If they are motile, they will move around. If they are non-motile, they will remain with the inoculation piece here. This is swarming of Proteus from what you see in the lab. هلا بنحكي عن coliforms and public health. عادة coliforms هم بنسميهم these are the عادة the gut bacteria are the coliforms, and they are used as a determinant for how clean your water supply is, how clean your food supply is. So public health بيهمني أنا food and water. So if food and water are clean, they are probably a good determinant of public health. How do I detect cleanliness of water and food? Is by if they are penetrated by coliforms. معناته صار في break of hygiene between my sewer system, where the system of all the waste of animals and humans and whatever is coming into contact with water or food supply. If there is a contact, you will find coliforms in your water or in your food, and that's why we use coliforms as an indicator for public health. In these water quality tests we identify مين E. coli. شو عندنا agar نستخدمه بسرعة لل E. coli EMB. So you use EMB or triple sugar تقدر تعمل triple sugar راح تشوف acid with gas production. This is very easily producible and no H2S, so this is easily reproducible. And then EMB, agar, E. coli, and enteric pathogens are killed by chlorination of the drinking water. That's why we chlorinate drinking water. And then fecal contamination standards. We have a standard if we take from the water, and we can only see 4 colonies per deciliter of water. This is the minimum that is accepted. Disinfection of the public water supply is one of the most important advances of public health in the 20th century. This is very, very important. This made a huge stride in the improvement of health in urban environments. Antibiotic therapy, it must be used with appropriate sensitivity testing. Why? Because حكينا these gut bacteria, they always come into contact with antimicrobials. Antimicrobials للعلم موجودين بالchicken, موجودين بالmeat, موجودين بالdairy, موجودين بال some of the even some يعني كل dairy foods. You will find maybe some breads will have some form of antibiotics as well. So you have a lot of antibiotics in the food. ليش في أكل antibiotics in the food? Because they want to improve the yield. عادة it's economic. So يعني تدفع فلوس على الصحة عشان توفر فلوس بالأكل. So عشان تزيد الchicken, عشان تزيد الميت, عشان تزيد it fattens the meat. يعني إذا بتطعمي sheep and chicken and whatever, بتطعميهم antibiotics, they grow fatter. So you have more meat, you can make more money, but then you're going to pay that money on antimicrobials and loss of people who might be lost to these diseases. So as these gut bacteria come into contact with lots of antimicrobials, they can قاعد بتدربهم على هالميكروبيال, so they become resistant to these. That's why we must always do sensitivity testing, so we can target our antimicrobial therapy against these organisms. So potential agents are many. Penicillin, some penicillins, the more advanced penicillins, not the penicillin G, can be used. Some cephalosporins as well. Aminoglycosides حكينا, especially if you use them with beta-lactams. Chloramphenicol, tetracyclines for these curved ones and the more difficult ones. Quinolones, especially for the urinary tract, as well as sulfonamides. And then recall ذكر حكينا عن ESP production and carbamidase reduction. These are all the problems that you see with antimicrobial resistance in these, especially in the gram-negative gut bacteria. So now let's cover, this finishes our first lecture. We will go through pathogens that are both within and outside the enteric tract. E. coli, Escherichia is the first one. Diseases, E. coli is the most common cause of urinary tract infection and gram-negative rod sepsis. These are both things that are outside the enteric tract. It is one of the 2 important causes of neonatal meningitis. مين الثاني? Group B strep. Bug that is associated most with traveler's diarrhea, watery diarrhea. هذا مثلا عادة بيحكوها مثلا انت بتروح على مثلا انا يعني بالنسبه لي مين اللي بشوفهم الناس بترافلز diarrhea. I don't mean anything by this. Usually people who travel, لما انا كنت بالوست, people who travel to Southeast Asia, عادة India, Bangladesh, هدول الدول, they usually contact me about traveler's diarrhea. بمنطقتنا عادة people who travels through usually Egypt, كمان هدول بالنسبة لي أنا in my practice what I see. شو الإشي اللي بيشابه مثلا India with Egypt? Both of them are highly populated areas. Both of them have a lot of street food, right? And both of them street food راح يكون less hygienic, right? And you come from عادة مثلا إحنا مثلا بالأردن are more likely يعني more or less are not exposed to a high amount of street food. عادة الناس بالوست they love going يعني خاصة the normal ones, the middle class, the lower class people, they like يعني in economy they like going to eastern countries and إشي كتير بيحبوه street food. So they sample a lot of street food which might not be the most adequately cooked or adequately clean. So they come up with traveler's diarrhea. Traveler's diarrhea is not per se contaminated food. More likely that you are coming into contact with something, with a lot of bugs that are different from your gut. So because of these highly populated areas وعندهم كتير أكل and it's handled by many people that more that you are used to, so you have a destabilization of the flora and you have an innocuous traveler's diarrhea عادة 3-4 days and it will be gone. Some strains of E. coli are enterohemorrhagic and cause bloody diarrhea. هلا بنحكي عن the other 2 strains. So pathogenesis, E. coli is present in both حكينا humans and animals. لما كنا نحكي عن respiratory organisms, we were said that humans are the reservoir. لما نحكي عن gut bacteria, both are humans and animals. The source of E. coli that causes UTI is the patient's own flora. عادة the patient's own flora عادة من from the anal canal or from the anus right into the urethra. That's how it goes. And if you remember that we mentioned that females are more likely to have UTI in the community rather than males because of the shorter urethra in females. It has to travel. The bacteria will have to travel much smaller distance, and it's much quicker access into the bladder in a female anatomy than in a male anatomy. حكينا in the hospital where we put Foley's catheter. We put catheters into the patient's own bladder so we can relieve their urine. As we are putting, so there is no difference between male and female if you're putting a catheter. But we will see that males and females have the same amount of UTIs with different bugs other than E. coli in the hospital environment. So the source of E. coli that causes neonatal meningitis is the mother's birth canal. So this is acquired during birth. Source of E. coli that causes traveler's diarrhea is from food and water contaminated with human feces. The source of enterohemorrhagic E. coli is cattle, meat, burgers and steaks. مهم كتير للي بيقدموا امتحانات بالطب او امتحانات بالاسنان في خاصة الامريك بيحبوها كتير هاي. It's very important. Rare meat. ناس كانوا مثلا شو حكينا بنحب نحكي سيناريو لكل واحدة من الدايرية. السيناريو for E. coli 0157 is ناس قاعدين في barbecue and they're making steaks and burgers. A lot of them are rare. High steaks and burgers are contaminated and then they are undercooked. Both contaminated and undercooked. عاملين هالباربيكيو whatever. They all get diarrhea and the children have hemolytic uremic syndrome. يصير يحكي لك مثلا الchild صار عنده uremia وارتفع عنده الابصر شو صار عنده hemolysis وصار عنده ابصر شو. So all of this will give you the clue that you are talking about E. coli. Very, very important. So E. coli pathogenesis factor. What are the pathogenesis factors? We have pili. ذكر البايلي. These are the things that help it stick to the epithelium. And the pili are pre-dilated. يعني عليهم receptors mainly for the bladder مثلا or the gut. A capsule, especially for E. coli, capsule is again it's antiphagocytic. Anti-endotoxin is gram negative, so we'll have endotoxin, cause fever, sepsis, all these things. And it has 3 exotoxins. high, pyogenic, هدول exotoxin. انت الواحد اهم واحد فيهم هو الانتيروتوكسين. حكينا enterotoxin, this is the default enterotoxin. And 2 that can cause watery diarrhea. And 1 that can cause bloody diarrhea and hemolytic uremic syndrome. This is the Shiga toxin that is present in E. coli 0157 اللي هي this kind of diarrhea. So this is bloody diarrhea with hemolytic uremic syndrome, especially in children. تمام. Cells adhere to the GI epithelium and then start producing enterotoxin that causes diarrhea. So it's not by ingestion of preformed toxin. You have to ingest the actual bacteria. تمام. عندها 1 is called the heat labile toxin. It's a toxin that is destroyed by heat. This is similar to the one that is in cholera. ADP ribosylation of the G proteins that stimulates the cyclases. This irreversibly activates the cyclase, increase intracellular AMP. هاي حكينا diarrhea and this is the fluid. Lots of fluid loss from the intracellular environment. So الخلايا من جواتهم this cyclic AMP will cause the water to leave the cells. It will accumulate in lumen in large amount. This water will hide water that was lost from the cell. Where is the cell going to compensate? It will take from the extracellular environment and from the blood. So this is a quick way for dehydration. معناته diarrhea equals loss of blood. Effectively loss of volume in blood. Because you lose the cell water, intracellular water, and the cell will take water from the blood and the extracellular environment. So obviously you are causing less, so the cardiac output will go down, everything will go down. This will cause effectively cause reduction. This is hypovolemic shock, because if it gets to that to that area, it's the same as hypovolemia. زي كأنه في صار hemorrhage. So systemic vascular resistance will increase, left ventricular function will reduce, the capillary wedge pressure would also be reduced, and so on. So the other enterotoxin is a low molecular weight toxin. This is the heat stable toxin, which stimulates guanylate cyclase. So the normal default E. coli, the enterotoxigenic E. coli العادية, they don't invade. Diarrhea with no blood and no fever. This is the traveler's diarrhea, right? And then you have upgraded شوية, صار اسمه enteropathic, enteroinvasive. This one invades, but there's no enterotoxin. This is a strain that is invading, not يعني بالعكس, هذا واحدة توكسين واحد مش توكسين. واحدة invade واحدة invade. This one, the invade, obviously will cause bloody diarrhea, inflammatory cells been stooled, زي ما حكينا, with fever. So this is the invasive one. Upgraded more and more, it will take the Shiga toxin, and then this is called the enterohemorrhagic strain of E. coli, called the O157H7 serotype. This is the one caused bloody diarrhea with مع بعض toxin and invasion مع بعض. And it's a strong toxin called an exotoxin. ها اسمه enterohemorrhagic strain اللي هو Shiga-like toxin, vetotoxin, and it's one that can cause hemolytic uremic syndrome. As we mentioned, history can people in a مثلا outbreak of people who have bloody diarrhea after following consumption of undercooked meat, usually burgers, meat, beef مش chicken, beef. دائما راح يجيب الأسئلة, دائما بيجي beef, chicken, no, beef. It will be قاعدين بياكلوا burgers, قاعدين بياكلوا steak, قاعدين بياكلوا whatever. Blood, so they have ذكروا فيها مثلا شيء مثلا إنه لونه أحمر مع blood. This is something they can correlate with. So they are associated with a life-threatening complication, hemolytic uremic syndrome. And this occurs when the Shiga toxin enters the blood, hemolytic anemia, thrombocytopenia, and acute renal failure. This is one of the anemias, of the hemolytic anemias. This is very important as well for board exams. Urinary tract infections, certain O types. معناته إيش؟ There is a pili that predilect to the urinary tract. مش كل الإي كولاي بيقدروا يلزقوا بالإي كولاي بالbladder. So you need a certain serotypes that have the pili that can click and stick to the urogenital tract. Cranberry juice has flavonoids, a lot of berries, and a lot of these, especially cranberry juice has these flavonoids. These flavonoids actually inhibit the binding of pili to the receptors and may be useful in the prevention and not treatment of recurrent urinary tract infections. كتير عندي مرضى بيحكوا معاي that they have recurrent infections. I prescribe them to take cranberry juice. عادة عندنا ببيعوه بحبوب, يعني as a supplement, which is very helpful to these patients, especially those that have reduction in the مثلا واحد مع benign prostatic hyperplasia. أي شيء أي شيء بالجسم, إيش مكان وين مكان, أي شيء بيخفف flow of water, blood, saliva, CSF, whatever it is. أي شيء بيخفف الفلو بيعمل back flow, يعني بسكر هذا. الباك فلو هذا رح يصير فيها stagnation, رح يصير فيها growth of bacteria دائما, whatever it is, whatever it's CSF, blood حشر, gut, saliva, urine. In the case of urine, مثلا واحد عنده benign prostatic hypertension, hyperplasia, he has difficulty in urination for حسين stagnation of urine, they will have a lot. شو راح يكون the more common one اللي هي E. coli. So give him cranberry juice. Tell him to take cranberry juice when he feels dysuria, whatever. It might help him prevent urinary tract infection. Does not treat it. Once it happens, it is not a treatment. The motility of E. coli may aid the ability to ascend into the urethra. تمام. So this is the clinical aspects of E. coli. We are talking about findings. So هلا بدون ما تطلع أنا يعني إذا لا تطلع على السلايد واسمعني لما أحكي لك مثلا واحد عنده watery non-bloody diarrhea. شو هاي؟ traveler's diarrhea. شو major pathogenic factor؟ شو كان؟ the exotoxin. شو بيعمل؟ cyclic AMP, increase cyclic AMP. لما تعمل لاب للستول راح تلاقي RBCs؟ no. راح تلاقي WBCs؟ no. راح تلاقي fever؟ no. هلا this is actually funny, but some people report fever with bloody diarrhea. It's probably due يعني بس خفيف مش زي but it's probably not. bloody واحد بيحكي معك بيحكي لك عندي دايريا. شو معاه؟ عنده في blood بالدايريا. Yes, there's blood. Oh, okay. So this is important. This is significant. بتخاف دائما خاف لما تسمع في blood بالستول خاف دائما خاف. فكر في شيء مهم. E. coli 0157 probably is the cause. Hemolytic uremic syndrome راح يكون عنده hemolysis. This is a sequel. فمajor pathogenic factor راح يكون exotoxin and inhibits protein synthesis. RBCs في blood obviously yes. Histiocytes in the blood yes في hemolysis. So this is hemolysis. خلينا نحكي عن الأشياء outside urinary tract infection. شو major pathogenic factor؟ راح يكون the pili binding to the bladder. This is called the gal pili. شو راح تشوف لما تعمل له urine analysis? You will find white blood cells in the urine, positive urine culture. Neonatal meningitis. حكينا كل meningitis بالدنيا شو major pathogenic factor تبعها؟ capsule. So K1 capsule again. And then لما تعمل له lab تعمل له CSF. بتشوف positive CSF culture راح تلاقي white blood cells in the CSF راح تلاقي low sugar, high protein. So this is neonatal meningitis, bacterial meningitis. This is the same profile as a bacterial meningitis. And then sepsis. شو راح تلاقي sepsis؟ شو هو المشكلة؟ شو major pathogenic factor؟ endotoxin. شو راح يعمل؟ fever, sepsis, hypotension, DIC, high PTT. hypotension راح يكون عنده hypotension راح تلاقي عنده systemic vascular resistance شو ماله؟ واطي. cardiac output واطي. كل شيء واطي in that one. So this is called the distributive shock, and everything is reduced here, except I think the cardiac output would probably be higher. Okay, main lab results. شو راح تلاقي بالسبسس بالبلد؟ عنده لوكوسايتوسيس راح يكون white blood cell count عنده عالي. culture راح يكون وين؟ بالبلد. blood راح يكون positive as well. تمام. So clinical findings within the intestinal tract: diarrhea by the enterotoxigenic E. coli is usually watery, non-bloody, self-limited and short duration. هذه traveler. تمام. Enterohemorrhagic on the other hand, dysentery-like symptom, bloody diarrhea, cramping, fever, like Shigella. تمام. 0157 strain also causes blood diarrhea, which can be complicated by HUS. تمام. This syndrome is characterized by kidney failure, uremia, hemolytic anemia, hemolysis, and thrombocytopenia. راح يكون عنده bleeding. Hemolytic anemia is caused by enterotoxin that induces capillary damage, which results in the damage of red cells as they pass through the capillaries. وراح يجوا عليهم spleen and whatever and start to fragment these cells. These disorders هذول يسموهم schistocytes, can be seen on blood smears. مش مهم كتير تعرفهم من pathology. Schistocytes are only not present in This is all microangiopathic hemolytic anemia, including HUS. مثلا in one outbreak in Germany of HUS was caused by another producing strain caused type as 0104H4 and not 0157H7, but it's still the same syndrome. HUS occurs particularly in children. هاي مهمة كتير مهمة بيحبوها بالboard exams, who have been treated with fluoroquinolones or other antibiotics for their diarrhea. So تعطيه fluoroquinolone, Cipro, and then more likely that these children will be susceptible for HUS. تمام. Antibiotics should not be used to treat diarrhea caused by EHEC اللي هي enterohemorrhagic E. coli. You do not give antibiotics for this reason. تمام. Okay. Clinical findings outside the intestinal tract, community acquired UTI. These infections occur primarily in women. حكينا هاي. Short urethra, proximity of the urethra to the anus, colonization of the vagina with the fecal flora. تمام. كل هذا حكينا. It is the most frequent cause of nosocomial hospital acquired infection, which occurs equally frequently in both men and women. حكيناها because of the catheters. حكيناها. Urinary tract infection can be limited to the bladder or extend up the collecting system to the kidney. And if the bladder is infected, that is cystitis. Whereas if the kidney is infected, it's called pyelonephritis. Pyelonephritis is very, very important. لازم تخافوا منها الأطباء. Be very wary not to miss UTIs as they can ascend. إذا صار عنده pyelonephritis, it might cause permanent kidney damage. And I have seen this in my practice. Even though I'm mostly in lab medicine, I have seen this in practice. The most prominent symptoms of cystitis are pain. شو pain؟ pain dysuria. يعني while they are urinating, they feel burning. Frequency of urination. إيش يعني frequency of urination؟ يعني بضل يروح الحمام كتير. ولما يروح ما بفرغ كامل. بحس ضل يروح hesitancy مثلا ممكن. Patients are usually afebrile. Pyelonephritis is characterized by fever. إذا صار واحد عنده UTI صار معه fever, you missed it. Okay? This is very important. Very, very important. Pyelonephritis characterized by fever. هلا urosepsis إذا تطورت ال UTI صارت pyelonephritis. pyelonephritis دخل على البلد وصار عنده sepsis صار عنده shock. هذا بدك تدخله على الاي سي يو. تخيل. هذا بدخل على الاي سي يو بدك تعطيه نورابينفرين بدك ترفع له ضغطه بدك تعمل له مشكله يعني راح يصير عنده sepsis. As we mentioned, the systemic vascular resistance will reduce. He's in shock. You need to do a lot of work to save this patient's life. So UTI into pyelonephritis into urosepsis. This is the scenario. E. coli is also a major cause along with group B strep. حكينا of what? Of meningitis, especially sepsis in neonates due to their colonization of the female genital tract. Exposure of the newborn to E. coli and group B strep occurs during birth as a result of colonization of the vagina by these organisms, especially approximately 25% of pregnant women. E. coli is the organism isolated most frequently from patients with hospital-acquired sepsis, which arises primarily حكينا urosepsis from urinary, maybe even biliary or peritoneal, but it's mainly urosepsis. This is very important. عشان هيك لها اسم الحالة urosepsis. إلها اسم الحالة because it is very commonly acquired and most frequently from patients in hospital-acquired sepsis. Peritonitis is usually a mixed infection caused by E. coli and other facultative. ليش؟ لأنه كل شيء بيطلع من الجات راح يدخل على البريتونيوم راح يعمل لك peritonitis. E. coli is the dominant one, but you will have other كلهم كل الجرام negatives والجرام positive كل الموجودين والانايروبس كل شيء راح يكون موجود كل الفلورا بالجات راح تنزل على البريتونيوم. It is not their space. This is not it should be sterile mostly. So you will find that it will cause peritonitis, guarding. ايش يعني guarding؟ يعني المنطقه اللي بتحط عليها البيشنت بحاميها بسكر عليها and then the skeletal muscle around it guard مسكري هيك شاد كتير فبتعرف انه هذا عنده peritonitis. وين وصلنا؟ lab diagnosis. Specimens initially on a blood agar plate and on a differential medium such as EMB, McConkey, E. coli, ferments lactose كله حكينا هذا تمام. وين كنا تمام. Some of the important features that help distinguish E. coli from other lactose fermenting or gram negatives اللي هو شو؟ It produces indole from tryptophan, so it is an indole producer. ما بعرف احط لكم صورة له ما مش حاط. It's easy, you can find it on indole production. This is very important for E. coli. It decarboxylates lysine. It uses acetate as the only source of carbon. It is motile. Other than motility, indole production and are important for the EHEC. It does not ferment sorbitol. This is something that you can help in the diagnosis from other E. coli. So it follows all the other things that E. coli follow, but it does not ferment sorbitol. treatment uncomplicated cystitis. شو بتعطيه هذا انت لحالك من محاضرات الانتي مايكروبيال شو بدك تعطيه؟ ناتروفيرانتون رايت سيبرو ممكن تعطيه trimethoprim sulfa. These are things that you can give, but I will reserve cipro or ceftriaxone for something more complicated in the pyelonephritis. فبتعطيه cipro ceftriaxone. cipro كتير بتعارض مع كتير أدوية, ف you want to, that's why we reserve, and it's more potent, so بدك يعني بدك يعني تخبيه شوية. E. coli sepsis شو بدك تعطيه؟ cephalosporins, again ceftriaxone, cefotaxime, with or without aminoglycosides, and usually they do give aminoglycosides, especially gentamicin. sepsis بتخاف منها بسرعة, بدك تخلصها بسرعة. Neonatal meningitis, combination of ampicillin and cefotaxime is given. Ceftriaxone, does it help? It does help. But once the sensitivity comes, this is the combination that is to be given. E. coli, diarrhea, and again, these are US numbers. E. coli diarrheal disease, ما بتعطي antibiotics. Nothing. Sulfatry or loperamide may shorten the duration of the symptoms, but again, we worry, especially in children. Rehydration is typically all that is necessary in this self-limited disease. كل الدايرية because of our fears زي ما حكينا of hypovolemia, because diarrhea equals hemorrhage. Okay? Diarrhea equals hemorrhage. You lose blood as you lose effective blood volume. You don't lose RBCs, you don't lose, حتى الESR بيرتفع. الهيماتوكريت بيرتفع, كل شيء بيرتفع because you are reducing the water in the blood. So it's very important to rehydrate the patient, very very important. This is all that is necessary عادة. طب شو الفوق ميديسن عندنا بيحكوا له مثلا خد 7 صح 7 up, because why? It actually works. You have a lot of sugar will bring, and with a lot of water it will rehydrate that patient very quickly. Or rehydration solution بنعطى للأطفال. It will has all the electrolytes that they need to supplement the potassium with sodium that is lost, especially potassium, and other electrolytes مع المية بسرعة. هذا برجع rehydration for the patient. So this is very extremely important in all diarrheal disease. Prevention, reducing UTI, prompt withdrawal of catheter. إذا عندك UTI بالhospital بدك تشيل الكاثيتر بسرعة. تشيله. Recurrent infections by prolonged prophylaxis with urinary antiseptic drugs مثلا nitrofurantoin or trimethoprim, sulfamethoxazole. Reducing sepsis, prompt removal and switching side of IV lines. Can you get sepsis by E. coli مش من البايلونيفرايتس مثلا واحد من yes you can. ليش بالهوسبيتال؟ لأنه البيشنت عادة فكروا فيها, a lot of patients can't go to the bathroom in the hospital, so they will go basically they will go in the bathroom in the bed, right? There's a collection way. There's sometimes أو مثلا مرض يا دوب بيحملهم على الحمام بيرجعهم. So the hygiene is not ideal here. قد ما يساعدوا الممرض, أي ما يساعدوا عائلته, أي ما يساعدوا, he is sick and there is more likely to have a break in hygiene. مع إنه عنده IV line. So the dominant bacteria mean E. coli. Can it access? Can it dirty the line? It can. Can it cause sepsis بهالبني آدم المريض who already has reduced immunity? Yes. So obviously you have to maintain quality and hygiene and antiseptic technique in your IV line introductions. And then if you have any sepsis أو to reduce sepsis, شو بتعمل؟ بتضل تغير switching the side of IV lines, ما بتخليه مكان واحد, ما بتتركه فترة طويلة. هاي كتير مهمة. راح for doctors you will fight a lot of nurses about this area. Nurses sometimes خاصة عندنا they do not want to do this. They don't want to keep switching sides of IV lines. Travelers' diarrhea can sometimes be prevented by prophylactic use of doxycycline, say ciprofloxacin, trimethoprim, or pepto-bismol. تمام. Honestly, no one يعني none of my colleagues that I know ever do this. Some people give doxycycline for those patients for patients that are wary of travelers diarrhea, but this is rare. Ingestion of undercooked food or uncooked food and purified water should be avoided while traveling in certain countries. يعني مثلا بتروح على بعض الدول بدناش نحكي اسماء but you can حتى in popular media مثلا you can see in popular culture انه مثلا once you have this shock once you go من airport تطلع من المطار بتلاقي مثلا there are no streets او streets معبية مية ومعبية sewage وحتى الرائحة مختلفة. So in these kind of environments إذا أنت مثلا بتيجي من حاول دائما تشرب bottled water, only eat don't eat street food, try to eat well packaged food. Me myself I don't want to بديش احكي اسماء مطاعم بس انا بروح على مطاعم chain restaurants عادة ف if I have to or مثلا hotel restaurants just to prevent this. Okay, do we have enough time for salmonella? Let me see. Okay, so we will stop here for these two lectures, for this week's two lectures. We will continue inshallah next week with the rest. This might take us a bit longer to finish the gram-negative enterics, but that should be fine. ويعطيكم العافية.